10 expert tips for how to treat bleeding gums. About 600 million people experience some type of gum problem in their lifetime. But the good news is that most of these can be cured at home. And bleeding gums are the first sign of gum diseases like gingivitis and the more severe periodontitis. This Bright Side article will help you to treat your bleeding gums as well as tell you how you can prevent it altogether. Just like with any bleeding, holding a damp piece of gauze against the bleeding area will stop your bleeding. But if bleeding gums are a regular problem, you should visit a dentist. 2. Use a cold compress to reduce swelling and a warm compress for pain relief. Hold a cool compress, or even an ice cube against swollen, bleeding gums to instantly stop the bleeding. Keep the ice there until the bleeding stops, but if blood keeping oozing out even after 10 minutes of applying the compress or ice, consider calling a doctor. You can use a warm compress later to relieve pain. But use it only after the inflammation is gone. Add 1 teaspoon of sea salt to a cup of lukewarm water. Stir to dissolve the salt. Swish a sip of it in your mouth for about 30 seconds and spit it out. Do this 4 to 5 times. And do it twice a day, once in the morning and once before bed. Salt water reduces swelling in the gums, and aids in stopping gum bleeding. It also creates a temporary high alkaline environment inside the mouth, thereby making it difficult for bacteria to survive. An oral irrigator is a device that shoots water jets to clean the gums thoroughly. You can also add mouthwash to it for better antibacterial effect. Having the gums clean reduces the chances of infection that can make your gums bleed. Steep a tea bag in boiling water. After 2 minutes, remove it and let it cool. Now apply the tea bag on the affected area of your gums. Let it sit for 5 minutes. Tea contains tannic acid which can help relieve gum infections. Eating crunchy vegetables, like celery and carrots, between meals helps by removing food residue from the teeth and thereby prevents gum diseases. Eating these also helps generate saliva which further cleans the mouth. Also, because they contain low amounts of sugar and carbs, they do not contribute to tooth decay. A vitamin K deficiency can make it take longer for your blood to clot. That can be the reason why your bleeding gums are taking a longer than usual time to stop. Green leafy vegetables like spinach, kale, and lettuce are an excellent source of vitamin K. Including them in your diet should help. Boil a cup of water and put 1 tea bag of chamomile in it. Allow it to steep for 5 minutes. Now let the tea cool.